Right. So, specifically speaking about the healthcare security, right? Again, like the HIPAA compliance. So these are like specific. I think I would say like the services one need to make sure that at specific level one has to follow. I was talking about the key management service, the key MS, right? So it's mostly like every cloud provider has this nowadays, and easily you can plug and play. So maybe Kiran, let's go through this quickly, the list
Yes.
so that yeah.
Yeah. So yeah, these are the measures which I was explaining in the last, the earlier session, earlier conversation. Like this TLS and data level security, where we follow like encryptions, masking, hashing. Similarly, we leverage even cloud-related key management systems. As Praveen was rightly mentioning that, so every cloud now there is an agreement that they need to, kind of. So though cloud vendors, though cloud providers, even the cloud providers, they will be in mutual consent with the application owners and the vendors who are using the cloud. And it is between the agreement between the cloud provider and the cloud vendor, like the kind of agreement that has to be happen and setting up that. But from the application perspective, from the architecture perspective, so we need to follow all these steps in order to make our application and data HIPAA compliance, like transport and data level security, access controls for authentication authorizations and role-based access controls. So network security for firewalls, like as I was telling, like setting up a web application firewalls. If you take in AWS world, we have like both at layer 4 and layer 7 at shield and WAF level. Similarly, security groups. Similarly, this will be applicable for even Google Cloud like Armor and even Azure WAF. Security groups like only restricting the instead of using or allowing all the traffic, so restricting that with security groups and VPN connectivities. And similarly, audit controls that we frequently do audit checks at application and infra level audits. And even when we do logging and monitoring, the data should be masked, especially for the sensitive data. That cannot be sensitive data cannot be masked. Without masking, if we log it, it is actually a violation. Similarly, system activity logs, and there is a service level agreement, and backups are most important, data backups. If you lose the data, then definitely that is a part of both business loss and compliance issues. Similarly, DR mechanisms, even if the primary region fails, how the secondary region can take up that. These are all the different things that we manage both at the application, data, and infra level.